Hey there, and welcome back to Medical Minds. In today's video, we will explore cervical cancer, which is a preventable yet life-threatening disease that continues to affect women worldwide. We will focus on effective prevention methods in particular. Whether you are a healthcare provider, a patient, or just seeking to understand cervical cancer, this video is packed with information you won't want to miss. Let's get started. Cervical cancer is the fourth most common cancer in women globally. According to the World Health Organization in 2020, approximately 604,000 new cases of cervical cancer were diagnosed and 342 women died from the disease. Despite being largely preventable, cervical cancer remains a leading cause of cancer-related deaths, especially in low and middle-income countries, where access to screening and HPV vaccination is limited. Cervical cancer is a malignancy that occurs in the cells of the cervix, the lower part of uterus that connects to the vagina. Most cases of cervical cancer are linked to persistent infection with certain strains of human papillomavirus or HPV, particularly HPV type 16 and 18. HPV infection is widespread, and while most people clear the virus on their own, persistent infection with high-risk strains can cause cellular changes that develop into cancer. There are two primary types of cervical cancer. Squamous cell carcinoma. This accounts for 80 to 90% of cervical cancer cases and originates in the squamous cell lining the outer part of the cervix. Second is adenocarcinoma. Less common but still significant. This type arises in the glandular cells of cervical canals. The primary cause of cervical cancer is infection with high-risk strains of HPV. However, other risk factors can contribute to the development of the disease. Engaging in sexual intercourse at an early age increases the risk of contracting HPV. Having multiple partners or a partner with multiple partners raises the risk of HPV infection. Individuals with weakened immune systems, such as those with HIV, are more susceptible to persistent HPV infection and the progression to cervical cancer. Tobacco use is associated with an increased risk of squamous cell cervical cancer. Chemicals in tobacco can damage the DNA in cervical cells, contributing to cancer development. Prolonged use of birth control pills, 5 years or more, has been linked to an increased risk of cervical cancer. In the early stages, cervical cancer often presents no symptoms, which is why regular screening is so important. As the disease progresses, women may experience symptoms including abnormal vaginal bleeding, which may occur between periods, after intercourse, or post-menopause, persistent pelvic pain, pain during intercourse. This can indicate advanced cervical disease. Unusual vaginal discharge that can be watery, bloody, or foul-smelling. Because these symptoms are non-specific, they can often be mistaken for less serious conditions, making routine screenings essential for early detection. The human papillomavirus vaccine is a critical tool in prevention of cervical cancer. HPV is a leading cause of nearly all cases of cervical cancer, with high-risk strains such as HPV 16 and 18, accounting for approximately 70% of cases. The vaccine, including Gardasil 9, is designed to protect against these high-risk HPV types, as well as other strains that can cause genital warts and additional cancers. Administering the HPV vaccine, particularly before individuals become sexually active, significantly reduces the risk of HPV infection and consequently the risk of cervical dysplasia and invasive cervical carcinoma. Clinical trials and epidemiological studies have demonstrated that widespread vaccination leads to a dramatic reduction in HPV-related infections and cervical cancer incidence. A 2022 study published in The Lancet showed that HPV vaccination has led to an 87% reduction in cervical cancer incidence among vaccinated women. The vaccine is most effective when administered to both male and females, starting from the age of 9 to 12 years, with catch-up vaccination available to age 26. Other preventive measures include safe sexual practices. Using condoms and limiting the number of sexual partners can reduce the risk of contracting HPV, although condoms do not provide complete protection, as HPV can infect areas not covered by condom. Regular screenings, routine pap smears, and HPV testing are crucial for early detection of precancerous changes, which can be treated before they progress to cancer. It is recommended that women begin regular pap smears at age 21 with follow-up screenings every 3 to 5 years, depending on their age and health history. HPV tests can identify the presence of high-risk HPV strains that are more likely to lead to cervical cancer. For women aged 30 and older, HPV testing is often combined with pap smears in a procedure known as co-testing. One significant study published in the New England Journal of Medicine in 2023 demonstrated that women who undergo regular HPV testing in addition to pap smears have a 50% lower risk of developing cervical cancer compared to those who only have pap smears. In conclusion, cervical cancer is a preventable disease, and with the right screening and preventive measures, it can be caught early or even entirely avoided. Remember, early detection saves lives. If you haven't already, schedule your screening and talk to your doctor about HPV vaccine. Thank you for watching Medical Minds. If you found this video informative, please like, share, and subscribe for more health-related content. Take care of your health and spread awareness about cervical cancer prevention.